differences in what gets to the good health outcomes is maintaining standards of care and adhering to international guidelines. So we come back to our standards of care. So it's clear that we need them, clear guidelines and standards. So how do we get these standards? By collecting data, like we showed already in the slides before, and comparing outcomes and sharing experience. So like I said, we're not going to look who is the best. Of course, we all look for who is the best, but that's not what we have to focus on. But for each aspect, learn from each other. And again, the same slide where you compare the outcomes. And here is my double slide again. But who is making those standards of care? And usually, if we have some guidelines on our standards of care, it's collaboration. And there was an European project that brought experts together, ECORN. There's a European CF registry. You have consensus meetings, and you already have some national guidelines, and all these things are brought together, and then the best practices are made into the guidelines. Until now, the most used European standards of care, when we spoke about the European standards of care, it was a document from the ECFS. ECFS is the European Cystic Fibrosis Society, so that's mostly the doctors, allied health professionals, researchers who come together in a group. And they wrote a paper, but 2005 is a long time ago. Many things progressed, luckily. Some things became more complex. So there was a high need for new guidelines. So this year a new document was published. This is thank you. And this is a booklet. I don't know if all of you saw it. I have 2 extra journals with me for people who really don't have access to it. And that was made together with experts from many countries, and it was led by the ECFS. CFV worked together in several patient groups. And in the introduction to the guidelines, you see that we've seen already the survival age continue to grow. This is the comments of the American CF Foundation to the European standards. And they say, of course, the better survival is due to more effective therapies, but it's really also a consequence of better strategies to use those therapies. And that's what we really have to work on too. And it's by using the registries, making guidelines, and provision of multidisciplinary care teams, and quality improvement. So we look at, so what is in these standards of care? You have the golden standard. We've heard it several times yesterday that someone said this is the golden standard, where you have some scientific evidence that tells you this treatment works best. In everything, unfortunately, also economy plays a role, because it has to be something that you can pay for. But what is really important to have a golden standard, what's the best, is the impact it has on the patient's life. And the standards of care are about a whole care spectrum, from diagnosis to prevention, treatment, life support, care organization. And if you look at many studies, you see what are better chances related to. We've heard it today already. You have early diagnosis, timely, correct treatment, regular follow-up in a CF center, preventive measures, infection control, physiotherapy, nutrition. So all these things are brought together. A lot of questions are asked, what should we do in this case? And experts look for replies to that. There are 3 main parts in the standards of care: the framework, the organization of the care, and there you see it's mostly about how you set up a good CF center, best practice guidelines, which treatment, which care do you give, and quality management. How do you get feedback? How do you really look that you give the best care? So this is just there's a chapter on the framework. You've noticed already, we all know that CF is a complex disease, and you see here all the parts of the body that are, or systems that are affected. There are all the kinds of therapy. It takes 4 hours a day for a patient if they do everything. It's very complex, so that needs also a complex organization. so multidisciplinary care for the different medical specialties, including psychosocial social care, nutrition, physiotherapy. And if we look at it, it's only CF centers offering multidisciplinary care that are able to really do a good follow-up. And it also involves a lot of daily care at home, which the parents and people with CF present here know all too well. So we need this whole care network around the person with CF and the family. And if we look at the guidelines for a CF center, what's really central is the CF team, with several medical specialists, physiotherapists, dietitian, CF nurse, psychologist, social worker, microbiologist, regular checkups, specific treatments have to be available, and the segregation policy, which was already explained with individual rooms yesterday. That's the ideal. What we all really have to work to that we get there. If you look in real life, to prepare the centers of life, there was a survey done in a number of Eastern European countries, and you saw that there were very few centers who had any of these specialties, although we all know that it really makes a difference in the quality of life and the survival, but it's not so easy. This is taken out of the new standards of care. How many people do you need at least for how many patients in the pediatric clinic, and how many do you need in the adult clinic? But it's not only about the number, it's also about the quality of the people who work there. And another important aspect is that you need at least 50 patients per group, so for the children or for the adults, because you need enough patients to have enough expertise. There's so complex a disease, there's such a variety of symptoms, and if your group is too small, you won't have enough expertise to know how to treat all the problems and complications. And you have to have time and resources to train and specialize, and for the specific needs for children and adults. I put a sort of a cross over a building because I heard yesterday a lot of people still think that the CF clinic is like a separate building, because we think of a clinic, a center, you imagine somewhere. It's not really about a building. It's really great if you can have great facilities and lots of room for everyone, but it's really about the people who work there and how they organize it in the hospital that makes the health outcomes better. So then the second part is the best practice guidelines. There is a part on respiratory treatment. We don't have time to go through all of it, but all these elements were already discussed yesterday. Antibiotic therapy is an important part, but you also have, for several of these aspects, you also have separate guidelines, because this gives the big lines. You see, it's not, if you would discuss everything in detail, you need a book that comes from the floor to the ceiling. Thank you, this thing. So there are also, like last year, there was also in the same journal something on how to treat pulmonary infections, some sort of consensus guidelines. There are guidelines on nutrition and enzymes, diabetes, also quality of life. We've discussed that more yesterday too. Which psychosocial support can you give for the patient, the family, and also the team? I'm not sure after yesterday if we think a psychologist in the center should look like that, or if this is more the approach, but I think yesterday it became clear that it's good to have some people who have been trained in psychological support to be present and to be available to patients and families. The third part of the standards of care is the quality management. A big part of it is a registry, a national registry, international, but Vincent will go deeper into that. And to have a good data collection and a good use of data. This is for the whole group, but also per center, like I showed, that you have to review your own practice to make sure that you're continuously control yourself, that you're giving your patients the care they really need and is best with the best result. This is just an example of the States also, where they where they look at, in our center, we have this score for all these parameters. This is a national average, but the national goal is where we should be if we really want to be a good performing clinic. This is the example from Belgium. So in Belgium we don't have neonatal screening, unfortunately, but we have diagnosis on average for 7 months. Luckily we can say that no child dies of CF. 56% is older than 18, 10% is older than 40, the oldest is 76, the youngest is born this week. And if you look, we also have difference between centers. I think most countries have that. This was a couple of years ago. One of the centers looked at per age, like what is the difference. You usually look how fast the lung function, the FEV1, is going down. And in this center, they actually noticed that the children always got a better lung function the older they got, because the longer they had treatment in that clinic. So that showed them that at least for lung function, they were doing a good job. And then they checked with, at that time we didn't have the European guidelines so detailed, so they compared with the American guidelines, and they saw actually that for each of these parameters they were reaching them totally. So it was an example for that if you follow the guidelines, you can really get very good outcomes. It's an ongoing process. It's not because now we have this booklet and now we know what to do forever and ever. It's a really important document to start, but continuously new guidelines are being made. For instance, at this time there is a feedback round. People are asking all around the world about guidelines on depression and anxiety. They will be published soon, and everyone is asked to give their opinion to make sure these guidelines are the best for everyone. And then it's the same on NTM guidelines. And a good thing is really that America and Europe are really working closely together to get a maximum consensus on how more expert advice you have, how more data, how more you can know that the standards you propose are the best available at the moment. So it's ongoing by the whole CF community, CF world, but also by each center should continuously check if they are following and up to date with the most recent guidelines and standards of care. So where do you find all this info? If you want to know how do we know what are the latest guidelines, the journal I already showed you, which is published by ECFS. There's the ECFS website where they have a specific part where all the consensus guidelines, also new articles, if there is like an important international article on and they found something like this treatment is good or not, you can find it on the website of ECFS. There's also ECORN CF. This is European expert advice, where you can ask a question in your own language. Greek is there as well. And it's European experts that reply to your question, and they always go and check what are the latest standards, what are the latest guidelines for your specific question. So you ask a question, and you have you can register as a patient or as a healthcare team member. This is just some slide of the Greek side. So it's a good place also to find what are the latest guidelines on a specific subject for CF. So we already said we need guidelines to know what is good care, but you also have to implement that good care. Have the necessary expertise, review regularly, organize your clinic and your care that you get the best care. And of course, a part of the problem remains everyone should have access to that care. So we need continuously, as patients, as families, together with the health professionals, make people aware and educate people. And if I say people, that are patients and families, but also doctors and other health professionals, and the authorities, can be the clinic administration, can be the ministry, to remind them what are really the best care options. And then also lobby for the best use of resources. And maybe your government may be ready to pay for very expensive treatment, but it's up to the CF group, the CF community, patients, families, and doctors and health professionals to see what we really need, what is the most needed in our country to improve the care. So conclusion, you need a strategy, need data, you have to collaborate, and then together the result should be consensus guidelines on standards of care, should lead to better care, better outcomes, and better quality of life. Always in mind the individual patient, and that's why we are all doing all this work, why we have the guidelines. And for instance, if you look at this guy is called Jesse. At this time, he doesn't look too happy because he has his weekly supply of treatment ahead of him. But thanks to that good treatment, he's actually now part of Cirque du Soleil, which is a very well-known international circus. And he's working there as an acrobat, and he's traveling around the world doing circus acts. Although he has like a really main form of CF, so he has a heavy treatment, and he told me how he gets up in the morning and does his nebulization before he goes on the podium and does his acrobatics. And in the break, he's quickly taking his medication. So just to tell you, standards of care, we're not there yet, but we can offer a good life, quality of life, and help people realize some really special dreams by collaborating for better standards of care. Thank you. Are there any questions or comments?